Welcome to this advanced psychomotor demonstration of medication administration across all major routes. Safe medication delivery begins with the rights of medication administration: right patient, right medication, right dose, right route, right time, right documentation, right reason, right assessment, right education, and right evaluation. Perform hand hygiene, verify allergies, assess the patient's ability to receive the medication, and confirm clinical parameters such as blood pressure, pulse, glucose, or pain level as appropriate. Always explain the medication and its purpose before proceeding. Begin with oral medications. Position the patient upright at 90 degrees to reduce aspiration risk. Use a medication cup and do not touch tablets directly. Assess swallowing ability. Offer water unless contraindicated. For scored tablets, split only if the drug is scored and ordered. Never crush enteric-coated or extended-release medications. Have the patient swallow each medication individually. Monitor for coughing, pocketing, or difficulty swallowing. Document tolerance and evaluate for expected therapeutic response. Sublingual medications are placed under the tongue where they dissolve rapidly into the bloodstream. Ensure the mouth is moist. Instruct the patient not to chew or swallow the tablet. Avoid giving water until it dissolves to prevent interference with absorption. Monitor for rapid onset effects, especially with nitrates, which may cause hypotension or headache. Buccal medications are placed between the cheek and gum. Instruct the patient to allow complete dissolution without chewing. Alternate sides for repeated dosing to prevent mucosal irritation. Avoid food or drink until fully absorbed. This route bypasses first-pass metabolism, requiring careful monitoring for systemic effect. Topical medications require clean gloves. Assess the skin for integrity, rashes, or open wounds. For creams, ointments, and gels, apply with a gloved finger or applicator using thin, even layers. For patches, remove old patches first, clean the site, and rotate locations to prevent irritation. Fold old patches in half to prevent accidental exposure. Document site and time, and teach patients to avoid heat sources that increase drug absorption. Nasal medications require the patient to sit upright with head slightly tilted. For sprays, occlude one nair and insert the nozzle into the other while the patient inhales gently. Aim away from the septum to prevent irritation. For drops, position with the head fully extended. Keep the patient in position for 1 minute to allow absorption. Avoid excessive blowing immediately after administration. Ophthalmic medications begin with hand hygiene and gloves. Clean the eye from inner to outer canthus if needed. Tilt the patient's head back and ask them to look up. Pull down the lower conjunctival sac and drop medication into the pocket without touching the dropper to the eye. For ointments, apply a thin ribbon along the inner edge. Apply gentle pressure to the nasolacrimal duct for 30 seconds to reduce systemic absorption. Vision may blur briefly. Ensure safety before ambulation. Otic medications require warming the solution to body temperature to avoid dizziness or nausea. Position the patient with the affected ear upward. For adults, pull the pinna up and back. For children under 3, down and back. Instill drops without touching the ear canal. Have the patient remain in position for 2 to 5 minutes. A cotton ball may be placed loosely if ordered. Vaginal medications require privacy, draping, and gloves. Position the patient in dorsal recumbent position. For creams or suppositories, load the applicator, insert gently along the posterior vaginal wall, and depress the plunger. Withdraw carefully. Instruct the patient to remain supine for 10 to 15 minutes to allow absorption. Educate about possible discharge and the need for hygiene without douching. Rectal medications require gloves and lubrication. Position the patient in left lateral Sims position. Separate the buttocks and gently insert the suppository or applicator past the internal sphincter, approximately 1 inch for children and 2 inches for adults. Ask the patient to remain on their side for at least 5 minutes. Rectal medications are contraindicated in neutropenia, rectal bleeding, or recent rectal surgery. Conclude by evaluating therapeutic effect, monitoring for adverse reactions, documenting thoroughly, and educating the patient on what to expect. Advanced medication administration integrates skill, precision, assessment, and critical judgment to ensure patient safety with every dose.